We need to make it known.
Three strangers connected through heartbreak.
This is a system, and nobody's paying attention.
Joanna Heiskill lost her mother.
The next phone call I got, they were rushing my mom in an ambulance to the hospital.
Tracey Pompey's father suddenly died.
He started vomiting stool and never made it to the hospital.
Kelly Edwards' mother passed away at 72.
The last few years of her life was filled with neglect, abuse, and pain.
They belong to the local group Justice and Change for victims of nursing facilities.
I'm disappointed at the way our government has decided to shun the elderly.
According to AARP, since the start of 2021, Virginia ranks second in the nation for the highest death rate in nursing homes.
And the truth of it is we need to be paying attention to this now because largely we haven't been paying attention to it before.
Virginia State Director Jim Dow shares somber statistics.
1 in 10 still don't have a week's worth of protective equipment.
1 in 6 nursing homes reported an insufficient number of care workers or nurses on staff.
Before COVID-19 happened, nursing homes were having really tragic problems with infection control. And it's usually largely a function of their staffing levels.
I've been at this almost every year for 20 years.
Delegate VIVIAN Watts reveals Virginia is one of the few states in the nation without minimum staffing requirements in nursing homes.
It is not satisfying for many to work in a nursing home. It's not what they wanted to do to help people.
In return, the most vulnerable require the most attention. Personal injury attorney Derek Walker at Allen & Allen believes these deaths are preventable.
Far too often, we're seeing CNAs that are taking care of 20 patients on a shift.
New Jersey mandates 1 nursing assistant for every 8 patients, the same ratio in Delaware. Right now, federal law requires Medicaid certified nursing homes to have a licensed nurse on duty 24 hours a day. But Virginia mandates homes to staff in sufficient number to meet the addressed nursing care of all residents.
They are corporations. Their bottom line is to turn a profit.
Amy Hewitt with the Virginia Healthcare Association said in a statement that long-term care providers were already facing a workforce shortage prior to COVID. She said they have been calling for help for years with recruitment and retention challenges. Others argued the pandemic only added to infection fears, and increased unemployment benefits led to fewer staff available for hire.
Not all facilities are bad, but the ones that are bad, they know they're bad.
These women urge you to pay attention because one day you also might find yourself in the care of strangers.
I still felt the need to find justice, if not just for my dad, but for other people.
Well, the story doesn't stop here. Tonight at 11, we hope you'll join us because we'll dig deeper into this issue and we'll also talk money. Delegate Watts will reveal the cost to taxpayers that she says it will cost Virginia just to make it up to the minimum staffing requirements up to par to other states. But advocates say that staffing is not the only solution. We'll have more tonight at 11. Working for you in Richmond, I'm Brennan King, CBS 6 News.